And we support state universal access programs that address high-risk pools and reinsurance that makes affordable coverage available to those who are sick and those who have a pre-existing condition. And I won't go through all of those things that Dr. Bustani and others here have talked about. But and our approaches are somewhat similar on this issue pre-2014, in the period where the House and Senate bills are ramping up. But there is a pretty big distinction, and that is that there's a key difference in the approaches. We prevent waiting lists during that period, and we have these programs managed by the state level, and they're robust enough that CBO has scored that they'll be effective. And what the House and Senate approaches are is that those rules are set in Washington. And the House and Senate bills are similar in that if you look at the Senate bill on page 48, 51, and 52, it's the unelected Secretary of Health and Human Services who has the authority to establish waiting periods for access to these programs, raise premiums, reduce benefits. And so it is a very, well, we are similar in what we talk about. There's a very key different approach there. And then after 2014, when the bill fully comes into play, you have a very different approach there. And what you do is establish pre-existing condition and link it with the individual mandate. And the American people have told us they don't want to be forced to buy health insurance that they don't want and they can't afford. And this is a significant issue across the country. And the American people are telling us that the individual the mandates, the requirements to buy insurance are something that they want us to scrap and start over on. And that's why you're seeing state legislatures around the country passing resolutions saying our citizens are going to have a choice on whether they buy health care. They're going to have a choice on the kind of coverage they want to have. And so this is a fundamental difference in this area of insurance reform that I think we have to really begin again and really take into what the American people are saying and expressing this through their elected representatives and the state legislators. I know there's a lot of former state legislators here. I'm one as well, and I think that's a very serious point that we need to address.
I'll just touch on your last point, which is the whole issue of pre-existing conditions. Tom Harkin mentioned it, but I'll be very brief because I know that we've got to move on to the next topic. The way I understand Leader Boehner's bill works, and I think that's the one you're referring to, the way you deal with a pre-existing condition is to essentially set up a high-risk pool. I mean, that's the mechanism. So what you're saying is if you're sick or older or you got hip replacements or what have you, and you're having trouble buying insurance on the open market, you're going to be able to buy into a high-risk pool. Now, Tom made the point earlier that, and this is indisputable, I don't think anybody would disagree with this, that if you set up a high-risk pool in which you don't have healthy people, younger people in the same pool as older, sicker people, the premiums for the older, sicker people who've been segregated into this pool is just going to be higher. Now, we looked at the Boehner bill to see sort of how you approach that, and you've got some reinsurance. And keep in mind, we use a high-risk pool as well until we get to the exchange, and we have reinsurance, for example, for federal or for people who are on retiree plans. We want to help employers maintain those plans, and they've got an older population, so we want to help reinsure them. Given the amount of money that you have allocated for that pool, it's just not going to be a very useful tool for the vast majority of people who've got pre-existing conditions, just because there's just not enough money that you guys put into it to be able to cover all the people with pre-existing conditions, which is why other states have high-risk pools. Kathleen mentioned. There are, I don't know how many states, but let's say 20, 21 states currently have high-risk pools. Out of all those 21 states, about 200,000 people use the high-risk pool. And the reason is because by just dealing with older, less healthy individuals separately, or people with pre-existing conditions, it is very, very expensive. Tom's point was, if everybody's in it, because presumably none of us know at any given moment who's going to end up being healthy and who's not. We don't know whether our kids are going to be suffering some sort of disease that we don't anticipate yet, or our spouses get ill. That if everybody's in it, then that drives prices down cheaper for everybody. So it's not that I think that the high-risk pool idea is a bad one. As I said, the House, the Senate bill, the proposal that I put forward, all use the high-risk pool as a stopgap measure to get to a broader pool, but the goal has to be to get everybody in a place where those risks are spread more broadly.
And if I just might say, we support high-risk pools and reinsurance with $25 billion in funding.
Right.
The House and Senate versions are $5 billion in funding, and because of that robust support, CBO says this will work. The fundamental difference after that is that the Health and Human Services Secretary, in that 4-year period when they're somewhat similar, has the authority to raise the premium. So all of that is brought to Washington. We leave that authority in the states so that they can manage their state pools. And then after the bill becomes effective in 2014, the real problem becomes the mandate and the cost, the forcing of the purchase of insurance, which many Americans find objectionable, and that you can avoid that mandate if you continue to design this as we do in the beginning.
Well,
and both plans are somewhat similar on that, but it's a very different structure.
What I'd like to do is to move on to the topic, which I think underlies.
Jay Rockefeller.
Oh, I'm sorry. We still got Jay. My apologies. Jay, please go ahead.
Thanks, Mr. President.